Hello, and thank you for contacting Wave Support. I see from your case here that you have a patient who sounds like they're pretty successful with these lenses already. There sounds like they're riding a little bit high, and we're getting awareness that they almost want to pop, and we're observing some extra clearance in this lower part of the lens area. So if we look at the lens designs, well, first thing we want to look at is this is a pretty symmetrical looking central area here. If we look at our designs here, I think overall your designs actually look really good. I would have anticipated this lens to center very nicely on the cornea, but obviously we have a little edge lift, so we're getting a little bit of a discrepancy there. What I might recommend, you have a couple options to, if you're going to stay with this particular lens design, a couple options would be, I notice you're in freeform, and if you want to tighten up this lower meridian, this lower half, you could just click down here, go to 50%. If you remember, that's going to change this lower half of the lens and just snug that side of the lens up. Just bring it down. That's probably the path of least resistance, and that'll probably help out, bring a few clicks down. That'll help bring that lower area in. A couple observations though. You've got, if you look at your cornea, you've got obviously the steep meridians vertical. You've got the flat horizontal. So as you know, this lens is going to want to rock over up and down this way. If we look at the lens design that you have, if we look at the base curve of this lens in this lower area, it's about a 734, and we look at the top part, it's a 746. So this top half, it's a lot flatter, a little steeper down here. So this flat zone, I think, is what's leaving it up in that upper meridian. Letting the lens slide up to the top part. So what I did is I mocked up a lens design here. It was just a possible suggestion for you. And what I did was I brought this down to around 7 to increase this landing zone area out here. But I switched it to GSIM. You have a pretty symmetrical area there. I know you get a little bit overhang over here, but it's pretty symmetrical. I went to the GSIM and redesigned that. And once again, you get a lens that looks very similar overall. But what you'll notice now, if you remember, we're averaging this entire vertical meridian. Now when we look here, we've got a base curve of 734. And if you go to the vertical meridian, we're also at 734. So we basically, in essence, steepened up this whole vertical meridian. So I think that will help this lens hug more in that vertical plane. And of course, if you want, you can always snug that up some more in that vertical meridian just to tighten up some more in there. So I think that would be a very easy fix for you. Another consideration might be, if you're unsuccessful there, is maybe trying a semi-scleral lens. If you're unfamiliar with that, in my email, I'll include the link to the Wave design video. Dr. Kodger put together a really nice 8-point step for designing a semi-scleral lens. And I'll tell you, they're very, very successful with a lot of these patients. In my experience, I'm finding that a lot of these patients have almost no lens awareness. I go about a 13.5 to 14.5 millimeter lens, somewhere in that range. It sits very nicely out here. We get very nice centration, very nice vision. And there's almost no lens awareness with these lenses. They're almost as comfortable as a soft lens. So I wouldn't totally rule that out, although it sounds like you're very close in your design, so I would work on snugging up that vertical meridian if you can, and I think that'll work well. Same thing on the other eye, and with that said, I would anticipate that you'll be very successful with this case. So once again, thank you for contacting Wave Support. I wish you well with this case, and have a great day.